Hi, my name is Dr. John Shim, and today I want to talk about the 3 personality types of patients that I see who decide to have surgery. Surgery has already been scheduled, but depending on their personality, there may be some issues that need to be explored. The first personality is that of the hard-charging optimist, the master of the universe, the person who is always on a tight schedule because they have another project that needs management. From their perspective, they have no time for back surgery. And like all their decisions, once decided, they are now all in and want it done now. These folks are in a lot of rush to get things done. To them, spinal surgery is a temporary obstacle to getting on with their life. These folks may not take the time to find out about the nuances of their situation. They may not explain the situation to their families very well, and sometimes they don't even hear the risks discussed with the doctor. If I'm describing you, then you need to slow down. You need to get the right advice. You need to prepare your household. Your work and your family all need to be aware of what's happening to you. Then you need to slow down enough to recover. You must follow instructions of the doctors and do all the things that will benefit your recovery. The second type of personality is that of the pessimist. If that's you, then you believe you will always have the complication. But that pessimism is a problem. Patients need to feel comfortable and confident they're making the right decision. The good news for pessimists is as you start making improvements, you start changing your attitude and you start feeling better. I find pessimists who have the appropriate indications for the operations often do very, very well. These patients are often the most grateful because the outcome is much better than they thought possible. The best personality for spinal surgery is that of the realist. If that's you, you do your best to understand your problem. You logically ramp up the intensity of your care over time. You understand there's risks and benefits, and you do the research to make sure you're getting the best information for your particular situation. For me, these patients are very pleasurable to take care of because they follow my instructions and they understand their problem and they ask thoughtful questions that help them recover from the process of surgery. I know all of you are in a significant amount of pain. That's why you chose to have surgery. But you must think, what kind of personality do I have? Am I that hard-charging optimist who may not understand the gravity of the situation? Am I the pessimist who just doesn't think anything is going to get better? Does your negativity cause delay in decisions and suboptimal efforts for improvement? Are you the realist who logically understands the problems and therefore does all things properly to improve your outcome? Understand that it's very important for you to look at yourself while you're going through this process of having surgery and planning for surgery. Your attitude, your personality may have bearing on your outcome. I'm Dr. John Shim discussing spine surgery patients. Please consider these issues while making your decisions. Thanks for listening.